morning, everyone, and welcome to the FHS webinar series. So what started as a group of professionals passionate about mental health in 2013 has now grown into a full-fledged NGO that runs the National Crisis Helpline, a community mental health center, and an awareness and outreach arm, and the research hub on mental health and suicide. Today's webinar will be presented by Dr. Zeinoun, and it is entitled Embrace: From Grassroots NGO to Social Entrepreneurship. Dr. Zeinoun is currently the Vice President of Embrace. She has initiated and led several projects, including the establishment of the Embrace Research Hub, and most notably the Embrace Mental Health Center in 2021, a full multidisciplinary clinical center and university-affiliated training program. From 2016 to 2021, Dr. Zeinoun served as Assistant Professor of Psychology at the American University of Beirut Departments of Psychology. And prior to that, she co-founded and led the Psychological Assessment Center at the AUB Medical Center since 2013. Her education includes graduate training at the Johns Hopkins Kennedy Krieger Institute in Maryland, USA, a PhD in psychology from Tilburg University in the Netherlands, while prior to that she had a Fulbright sojourn at Illinois State University, where she obtained a master's degree in clinical and counseling psychology. I'd like to thank you, Dr. Zeinoun, for accepting our invitation to give this seminar, and the floor is all yours now.
Thank you so much, Dr. Salem, for having me, and thank you everybody here. So I will be talking about Embrace, what has Embrace done. I know that a lot of you are interested in public policy also and healthcare, so I'm going to try to insert as much as possible about that. I plan to talk for about 30 to 40 minutes, and then we'll leave room for questions. As Dr. Salem told me, I'm very interested in hearing your questions, your thoughts about what we'll talk about. Okay, Dr. Salem, shall I rely on you a little bit regarding the time? I will look, but just let me know when I have just 5 minutes left.
Sure, Akid. Don't worry about it.
Thank you so much. I'm going to share my screen. Let's see. All right, everybody can see my screen, I think.
Yes, perfectly.
Great. So I'll start off just by introducing Embrace's mission. Let's see, how does this go next? Okay, like this. So for those of you that don't know, Embrace is a Lebanese NGO. It has a broad mission related to mental health, to ensure that people with mental health are respected, empowered, and able to access mental health care without constraints. And when we look at literature, some of the major constraints of accessing mental health are lack of knowledge, shame and stigma, and lack of resources. And each one of these three tenets leads to the action, what needs to be done. So for lack of knowledge, we need to build awareness and to have positive representation and capacity building. To reduce shame and stigma, we need to have supportive community programs. And to combat the lack of resources, we need to make mental health accessible and affordable and influence policy at the level of systems. So this is a big umbrella of where we come from. And for each one of these, there are certain programs that we have worked on. And these are going to be what I'll be talking about today. For example, to combat lack of knowledge through awareness, we have built a community awareness and outreach program. We have built a communications department. We have built a research hub. To make mental health accessible, we have built the national helpline, the Embrace Mental Health Center, a mobile crisis team, and different things. So I say this at the beginning just to always make the link that whatever it is that our NGO does is linked to this basic tenet and basic mission that we have. a bit of a history lesson first. For those of you that don't know, actually, Embrace started off at AUBMC with a few people. At that time, the chair at the psychiatry department was Dr. Ziad Nahas, if some of you might know or remember him. And him and a group of psychologists and psychiatrists and research assistants just got together one day and started thinking, okay, what can we do beyond just treating patients at the hospital? What can we do for advocacy? What can we do for awareness? What can we do to fund patients who cannot afford it? So really, it started off as very small, and this is why we pride ourselves as being that kind of a grassroots movement. Because students at AUB and in other universities got very interested and very involved, and slowly that community started growing, and people were doing things for Embrace and with Embrace at a very basic community level. And one of the first things that we did, trip down memory lane, is an awareness campaign called فكوا العقدة وبلشوا يحكوا صح المرض النفسي هو مرض طبي. And this really was the first launch of our large awareness stream, which I'll talk about today. These are just a few pictures from back in the day, from 2013, 14. I like this picture very much because one of the first things that as Embrace we did was what is called Walk into the Dawn, which is a walk that we do at 5 in the morning to raise awareness on suicide prevention. And we مثل ما بقولوا غمرنا صخرة الروشة. صخرة الروشة عندها كتير معاني بالمجتمع اللبناني. ما رح فوت فيهم هلا, but one of the things that we wanted to do as exposure and to raise awareness is this humongous poster on روشة. And this is Dr. Ziad Nahas, by the way, and these are some of the founding members and some of the General Assembly and executive members. There is obviously an organizational structure at Embrace to maintain operational efficiency, but also accountability and proper decision making. The main governance right now are these individuals, mostly mental health professionals, but also community members. And the current team, we started off as 2-3 volunteers, and what now is 18 team members, 5 mental health professionals at the clinic, interns in our training program, and 120 Lifeline operators that run the Lifeline. And our priority areas are, again, linked to that mission that I was talking to you about. So let's get Lebanon talking about mental health. Let's build capacity. Let's have some research, some data about mental health in Lebanon. Let's make it accessible through a community program. And so through these priority areas, what we currently do and the things that I will mostly focus on are 4 verticals, and we call them verticals because they're our main pillars. The National Lifeline for Lebanon, which is the 1564 Lifeline, the Embrace Mental Health Clinic, which also has a training component, CEDARS, which is our research hub, and awareness and outreach. I'll start off by talking a little bit about the Embrace Lifeline. Many of you might have heard of this because it is our flagship project. This is what we started off with. يعني back in 2013 كنا نفكر إنه يا ريت بلبنان في رقم واحد فيه يتلفين يحكي مع حدا يفهمه ويساعده. إذا حدا in a life-threatening situation to hurt themselves, at that point, you could call friends and family, but really you call the police or you call the Red Cross, and these entities are not properly trained. Now they are better trained because we've done a lot of that training, but back then this didn't exist. And so 1564 was the first lifeline. It's actually the only lifeline in the region after one that was established in Morocco and very recently one in the UAE. But other than that, in the Eastern Mediterranean region, we don't have such national helplines. And after it was launched, the National Mental Health Program adopted the Lifeline as the national and official lifeline of Lebanon. And what we do in the Lifeline is we provide emotional support. We assess for suicide risk and use methods to prevent suicide. And we help people know about community services in their area, therapists, psychiatrists. ما بيعرفوا مين لازم يشوفوا أو وين. We help orient them to these resources. Who runs mainly the backbone of this Lifeline are volunteer operators. Okay, so there are people like you and me who come in and get an intensive training in techniques like active listening, suicide prevention, emotional support, and know what to do when they're on the phone with somebody who is in distress or will hurt themselves. And very recently in 2021, we trained 106 individuals. And these are some numbers of number of volunteers across time. Particularly in 2020 and 21, we really struggled with keeping operators in because a lot of youth traveled and left Lebanon. So we had a lot of turnover with that. So this has really been one of the challenges in getting more volunteers, competent volunteers who are able to run this Lifeline. And we call them our hope makers because really they are the ones that provide the people who call with hope. Now, again, what we started in 2018 with 14 hours a day, but now in 2022, we are at 24 hours a day. And this is between me and you because we have just soft launched the 24 hours. We have not yet advertised it. Only a few days ago, we have been running full-time shifts. Hopefully when everything is smooth and all the systems are working, we're going to advertise this publicly. So هلا عندكم هيك sneak peek about what's going on. Since the start of the Lifeline, we have gotten more than 10,000 calls to the Lifeline since its launch in 2017. Now, you might ask me, who calls the Lifeline and why do they call the Lifeline? هلا, and a common question we get is طب معقول إذا حدا متضايق أو بده يقتل حاله بيمسك التليفون وبتلفن لحدا? And the answer is yes. Okay. The statistics about Lebanon on suicide show us that about 128 people take their lives every year. So if you look at that on an average of 365 days, it's about one person dying of suicide every 3 days. And these are the official statistics by ISF, by the police. We have a lot of reason to believe that this is an underreporting. And we do think that the numbers is actually much higher. And the average is one person dies of suicide every 2 days in Lebanon. So the problem is there, it exists. Now, do people call? Yes, people do call. Obviously, a big dilemma or part of our work is that we cannot share the stories, but we can share that even in the literature, in the science of suicidology, we know that when people are having these dark thoughts about ending their lives, there is a lot of ambivalence. There is a lot of back and forth. And sometimes having a person to hear you and to give you hope is that difference that tips the balance of ambivalence of I'm not going to do this today. The feeling might not go away, but for today, I will not be hurting myself. So it does help, and studies have actually studies on our Lifeline or other Lifelines have found an effectiveness. This is a study that I was part of that looked at 2 years of data in on the Lifeline. It was anonymous, obviously, data of about 5,000 calls. And we did find that there was a significant and large and effect size of about 1.94 in the reduction of the stress from the beginning of the call to the end of the call. And this was true for people who are either suicidal or only having emotional distress without suicide. So there is impact that is being done at the level of society through the Lifeline to address a real public health problem. Now, who calls the National Helpline? This is recent data. It's not historical. It's just from 2021, but it is similar to the previous years. Generally, the age group that mostly calls the Lifeline are those between 18 and 34. And we know from literature that it is this age group that also is the most likely to have mental health issues or to seek mental health treatment. نعرف نحن الonset of mental health disorders is typically in adolescents and late adolescents. So at about age 18 to 34, we're getting the most calls, but there are also those from teenagers under 18 and also calls up to age 64 and even above. The people call the Lifeline from all over Lebanon. There is an overrepresentation of Beirut and Mount Lebanon. The rest is more or less proportionate to the distribution of the population, but really not so much. We have a lot of more work to do in remote areas of Lebanon in terms of awareness and in terms of making the Lifeline accessible to those individuals. This slide is some testimonials of people. Again, as I said, we cannot share stories or what we call some of the success stories, but I can tell you that we have had a lot of people among these 10,000 calls who have really reached out to us to show, you know, to say how much the Lifeline has helped. So here, you know, we have the quantitative data from our studies. We have qualitative anecdotes from our callers that show the effectiveness of the helpline. And I wanted to show this to really show the struggles that we've been through, not only just from the beginning as an NGO and struggling sometimes to make ends meet, but really we have not been immune to the crisis of Lebanon. In the August explosion, our offices got blasted and we were still on calls while the glass is shattered around us. During now the electricity crisis, the fuel crisis, يعني بدنا نعمل supervision للoperators، ما في internet، ما في hotspot، ما في كهرباء. Operators اوقات قاعدين بردانين while doing the calls، ما في دفاية، ما بيفقد الموتور. So we had all of these challenges, and yet we still need to persevere for the benefit of the community. When you have a lifeline in any country, typically there is a system that works around the lifeline. So if there is an imminent threat to the person, you need to have a team that goes there and helps the person. Up until last year, this didn't exist in Lebanon. The only dispatch that could be sent was Red Cross or police. And again, there's a lot of issues when it comes to that. So last year, we piloted a program, again with the National Mental Health Program, whereby in cases of imminent harm, the person is literally at harm at the moment and is not able to be helped through a call or by mobilizing the community around them, then we are able to send a trained crisis team consisting of mental health professionals to help the person and typically eventually lead to hospitalization so that we can help stabilize them. This is a pilot phase. We hope to continue it after we prove its success. Our second vertical is the Embrace Mental Health Center, and this was kind of established right after the August 4 explosion. Now, this was in the pipeline of our plans for several years, but we planned to do it in 2021. But when the explosion happened, and we knew that a lot of people would have not only physical injuries, but a lot of emotional injuries, and that we're going to see an increased level of trauma response in the community, we really scrambled, and I don't know how, to be able to set up a mental health center in Hamra, in the first 2 months, literally, we just had like 2 plastic chairs in a room with different rooms where we could provide help. And after 6 months, it grew into a full-fledged center that has psychiatrists, psychologists, social worker, nurse, and really has provided about 6,000 sessions to people in the community, to about 700 beneficiaries. Through the Embrace Mental Health Center, we provide, all of this is for free, obviously, all the services are for free. In addition to that, we provided free medication through local pharmacies. We provided free acute hospitalization through partnerships with hospitals, so that we can really do as comprehensive a care as possible. And if you really think about these 3 lines of services, the Lifeline, the mobile crisis team, and the community mental health center, it's a cycle of care, right? From an accessible phone to an emergency response to a more slower paced therapy and psychiatry consultation and hospitalization. So it covers the full cycle of mental health care. Within the Embrace Mental Health Center, we had a big problem though, right? Like any discipline, psychology in particular is hit by a lack of trained professionals. There is very little capacity building. There are several training programs in Lebanon, but it's not enough to meet the demands of patients and of the issues that we have. So part of the Mental Health Center, we created a training program for psychology students who are doing their master's or doctorate to come in the center, get trained through observations, through service provision, didactics, supervision, really by world-class psychologists, so that we can build that capacity in future generations. And at the same time, these interns serve patients, so they also see beneficiaries, making it a win-win situation for everyone. So we use the, the medical residency model to a certain extent. The program started in 2020. We graduated 6 students last year, and this year we have 11 students who are hopefully again will be graduating in July or August. The third vertical I'll talk about today is the outreach and awareness. And I think this may be particularly interesting to people in public health because in mental health in particular, one of the key aspects that prevents people from seeking care is stigma and lack of knowledge. And so if we are to make any of these programs successful for the community, we need to raise awareness. And we do this on several levels. First of all, reaching the youth, reaching universities, schools, scouts, school students. We have done countless of these sessions. Sometimes we call them Mental Health 101, where we just talk about what is mental health, what are some red flags that you can identify in yourselves or in others, what are resources available around. And we give these almost on a weekly basis. What I'm doing today to a certain extent is outreach. We also target ضياع صغيرة, ضيعة ما بعرف وين, بلدية, a small community somewhere, so that we expand beyond Beirut وجبل لبنان to as many remote areas as possible. On the streets, for example, the Into the Dawn walk that I talked about is a major outreach event. This picture is from an event we did at AUB a few years ago, and we used to do this with clubs at AUB, doing several awareness sessions. Overall, in 2021 alone, we reached about 3,000 people through these mental health sessions, which is really a huge shift from the previous years. And mind you, the previous years there was COVID, and so there was a bit of a lull in our awareness activities, but we really pushed that up in 2021. Part of the awareness and outreach, it's also building capacity. So we have really made it a point to help other NGOs and other institutions learn about mental health and about suicide prevention. And this is a little bit where we've moved into that social entrepreneurship, because as an NGO, you have limited resources. And as an NGO, we rely primarily on donations. So what is one way to be able to also generate revenue and use that revenue to fund future services is to do these kinds of programs. So these programs of training and building capacity, typically we charge nominal fees or we ask for a donation. And this social entrepreneurship helps the community and helps bring funds back into the NGO to fund those programs even more in sort of a circular fashion. So these are some programs we've done with NGOs. We have built so-called packages where we teach things like about trauma, about burnout in the workplace. We do programs such as mindfulness or group CBT. We teach organizations, for example, like the Red Cross or Himaya or even the ISF and key organizations about suicide assessment and intervention. These are some of the institutions that we've worked with. For example, with AUB, we've done a nice mindfulness program to a group of students. And that was actually, we received really good feedback about that. These are some pictures from after the Beirut blast. Again, showing the extent to which we need to get at the level of the community to help. So right after the blast, mental health, yes, it plays a role, but not right at the beginning. At the beginning, there is rubble to clean. And I know that these are memories not all of us would like to delve into at the moment. But what our volunteers did was مثل ما بنقول شمروا على جنودهم ونزلوا على الأرض to provide any sort of help that can be done. And then later, we dealt with some of the mental health and trauma response that the community was going through. Finally, part of awareness is also the ability to quote unquote advertise. Here are some pictures that that show the public quote unquote advertising, for lack of a better word, that we've done. This is the number for the Lifeline. It was on several billboards in 2020 and 2020. Several little events were done in 2019. We wrote 10,452 messages on little post-its, and they were messages of hope. And we stuck them around cars on parking lots for people, regular people in everyday life, to see them and read them. These are some of the pictures of that. And these messages were written by our very own operators. In 2020, we did another campaign called حقك تحكينا, inspired by the justice or the sense of injustice that a lot of us felt in 2020. And a big part of mental health accessibility is social justice and social parity. Everybody has the right to have mental health and mental health access. And this is kind of what inspired this campaign, إنه حقك تحكينا وحقك يكون عندك المجال إنك تحكي عن مشاكلك وتقدر توصل لحلول لصحتك النفسية. This is another small campaign for Mental Health Day in 2020. So there's a number of small campaigns that we do throughout the year and some larger campaigns that we do. Social media is a major part of our campaigning and our outreach. For example, now we have this partnership with Facebook whereby if a person writes a status or posts something that is flagged by Facebook as that person is going to harm themselves, then that person is going to get like a safety, I don't know what you call it, a warning, a safety message that says, if you are in danger to yourself, please call the Embrace Lifeline 1564. بأمريكا هي موجودة مثلا وبيكون محطوط Samaritans or other suicide helplines. بالميدل East موجود 1564, and there's, because 1564 can only be called in Lebanon, there's also another 01 number that we've put for people outside of Lebanon, but we don't advertise that. It's just done for those really emergency situations on Facebook. We've done the same with TikTok, and now it's TikTok lists Embrace as part of its safety guidelines in the Safety Center resources for Lebanon, Egypt, Saudi Arabia, and the UAE. And this is very important because through literature and through our own reports, we see that age group, right, that adolescents, early 20s age group, the very high risk group, and this is the age group that is using social media the most, particularly TikTok these days. So that is about our outreach and awareness and training. Lastly, I will talk about CEDARS. CEDARS is another center that I've set up and Embrace. Stands for Capturing and Expanding Data Analytics and Research on Suicide. This is really a research hub that captures data in Embrace. So we capture data from the helpline, data from the Embrace Center, data from outreach, and kind of it has two main aims. One aim is academic, and that's my bias because I come from an academic background. So we do aim to publish and to work with academicians towards contributing to the literature through our data. But it has another very important aim, which is internal monitoring and learning. So we are held accountable to ourselves, to our board, to our donors, and we need to show that what we do works. And to show that, we need to have a very good and rigorous methodology for capturing data in the most anonymous and confidential way possible, and analyzing that data to continuously improve our processes. And I don't have very much time to get into this today, but if you do get involved with Embrace, you will see that we are obsessed about data. Again, this is my bias in the organization, but pretty much everything is measured and everything is reported to improve our services and to hold us accountable. And why I am at this topic, I would also like to say that those of you who might be interested in research projects related to mental health or suicide, or particularly efficacy of services at the community levels, please do get in touch with me, because we are always looking for academic partners who would like to work on these things. So that's CEDARS. Finally, this is the last thing I'll talk about. This is not a vertical by itself because it's still a pilot project, but this is a self-help program that works on an app. It's also in collaboration with the National Mental Health Program, and it's really for people who don't want to go to therapy, don't want to call the Lifeline, are tech savvy, and they want to work on themselves for mild depression and anxiety symptoms, and they do that through the step-by-step app, خطوة خطوة. I think we piloted it for a year. It went very well, and now it is continuing in 2022. And hopefully with time, it will grow as one of the main verticals. And linking this back to that cycle I was talking about earlier of making mental health care accessible, this is really a major part, because it closes that gap of providing access to people through an app anonymously, people who don't want or cannot go to the center do not want or cannot call the lifeline and just need something different. So that kind of, it's inserted there in that cycle of care that we've talked about it earlier. My last slide is just showing some of the partnerships that we have with donors and emphasizing that we do rely on donations to keep our services going, but we also need to be self-sustained as an NGO, and we take examples of NGOs in other countries or even in Lebanon who have been able to build to be partly self-sustained so that we can continue to provide these services to our community. And that's it from my end. Wow, I'm right on time, huh?
Yes. Great, great timing also. Thank you, Dr. Zeinoun, for this very interesting talk. It was very informative and very interesting to hear also. So now the floor is open for questions. So if you have any questions, you can raise your hand and unmute yourself and ask your question directly, or write them in the chat and I will read them for you. So starting with the questions, we have Hiba Hamdan is saying that she likes the messages of hope. This is a really nice idea. She thinks people might also be encouraged to pass the message of hope forward. And she suggests a similar campaign is much needed today with everything that is going on.
Yeah, absolutely. And I'll definitely pass this message forward to our communications team. They're always doing these things. يعني بيعملوا أشياء حتى ما حطيتها. Like one time, like for example, now they do this stress-free day at Embrace where everybody comes in with their pets and dressed in comfortable clothes. They do manicures and stuff, like little things, but عن جد sometimes they matter. هيدا بقلب Embrace بنعملها لأنه it is so stressful to work as an operator. It is so emotionally draining, and we really need to take care of each other. So هيدا هيك at the level of small community, and at the level of larger community, absolutely passing these messages of hope forward is a great idea, and I'll pass it on.
Great. We have Amal Watfa Karaki is saying, is Embrace collaborating with other NGOs besides the National Mental Health Com, such as NGOs working with women exposed to violence?
Yeah, so we have several, I don't know if I can call them partnerships, but several collaborations with a lot of NGOs. For example, Himaya with child protection, we work a lot with them because we refer patients, beneficiaries from the lifeline or from the clinic to Himaya. Kafa, for example, on working with women exposed to violence. Arc-en-Ciel, MSF, MSD, a lot of NGOs collaborate with us and with them because we send people to them because they are part of the community resources. One NGO cannot do everything. And we are not one to think إنه نحن بدنا نعمل كل شيء إنه ما فيك. If we have this idea in our head, we will never be able to benefit as many people as possible. So definitely those collaborations are ongoing. And we also have collaborations at the level of capacity building. A lot of these NGOs, for example, those working with women exposed to violence, their training is mostly on that. They don't have, for example, sufficient training in dealing with mental health issues in women exposed to violence or in mental health issues with domestic workers. So where we come in is where we provide that training and capacity building to those NGOs.
Okay, I have a few questions if you allow me. My first question is people who call the lifeline.
Mm-hmm.
How to say it? It's
say it as it is.
In Lebanon, it's a taboo to talk about anything related to suicide, to mental health. So how are you as an NGO or as a community raising awareness about suicide per se, and allowing people to reach out to you to get the help that is needed. Also, maybe we should start attacking this issue, the taboo issue, right from the schools.
Absolutely. Absolutely.
So maybe I don't know if you have any experiences, or if you have done, and if you have raised awarenesses at school, maybe to introduce these kids to these information at the early stage.
Absolutely. So as I mentioned, that's why outreach and awareness is such a major thing of what we do, and it's actually how we started with. يعني أول ما بلشنا بawareness campaign اللي فيها فكوا العقدة، إنه فكوا العقدة خلاص احكوا عن mental health. And awareness goes in tandem with the services, because if you're providing services but people are not aware انه what is mental health, وشو في كيف في اعرف اذا انا عندي mental health issues، وين في تلفين او روح. If you don't have that, no one is going to use the services. And starting when they are young, when people are young, is very important. We have in fact focused a lot on schools and scouts. Post August blast, we got a lot of requests from schools around the Beirut area. So we did a lot of awareness sessions there. Scouts are so well organized. كمان كتير بيطلبونا different clubs like Rotaract and whole youth organizations. كمان we have a lot of requests from them. كلهم بنلبيهم. And I'll give a personal experience when I go to these. So you know, we all give these awareness sessions. When I go to these awareness sessions, I remember I gave one at IC a couple of years ago. On average إذا عم نحكي مع 50 شخص, on average في 5 أشخاص رح يجوا من هيدا الawareness session يسألوني سؤال أو عنهم أو عن حدا بخصهم. And it's so accurate because the statistics in Lebanon show us that 1 out of 4 people will have a mental health diagnosis in their lifetime. هول studies معمولين by academics, whether AUB, St. George and others. So really 25%. So لما يكون عندي audience of 100 people رح يجي 25, audience of 50 رح يجي 15 أشخاص. أو عنهم أو رح يقول أمي هيك، خيي كيف يساعده، صاحبتي بالمدرسة عم شوفها عم تعمل هيك. And after those that they understand okay إذا عم بيعمل هيك لازم أعمل، هيك لازم أحكيه، ما لازم أقول له كذا، لازم أقول له كذا. And slowly the awareness spreads into the community.
Okay, perfect. We have another question from Amal Watfa Karaki. She's asking, what are the main social and gender characteristics of your clients?
That's a good question. So I'll talk about Lifeline and the health center because they differ a little bit. What is common is that women are usually at about 65% of beneficiaries. And this is not unusual because women are more likely to seek help than men. This is also seen in literature across different countries. It does not mean that women suffer more. It could be in certain disorders, but we do see that women seek more help. And interestingly enough, our data also shows that women improve more than men. There's something very special about that.
Maybe men in Lebanon or in the Arab world are raised to not seek help, maybe. This is an issue in our community also, no?
Absolutely. Men's mental health is very important, yet unfortunately underrepresented, and we're not socialized from an early age as men to, embrace feelings and issues. So yes, we see about 65% of beneficiaries being female, whether as callers or as patients to the center. We at the mental health center, about 40% of our beneficiaries report an income of less than 2 million. So there is also a lower socioeconomic status, which is what we seek. We do seek to help people who cannot afford to go to a therapist. A therapist today in Lebanon takes 500,000 for a session. إذا بدك تروح 4 مرات بالشهر كل جمعة تعمل ثيرابي، هيدي 5 ضرب 2 مليونين ليرة معاش بس تعمل ثيرابي. هيدا إذا ثيرابيست شاطر وقادر يأمن لك اللي بدك إياه. So we do reach out to people who or communities who are on the lower SES side, but sometimes وهلا بلبنان particularly based on the question that Amal is asking, there is no longer a good understanding of the purchasing power and the socioeconomic status. يعني كنا نعمل calculation للSES بطريقة، هلا ما فينا نعرف كيف الSES، كيف بشو بتقبض وبأي currency وين عايش. It's so difficult now. So some of our patients are in fact also people who used to be middle class, and then they can no longer afford the 2 million. So it's very difficult now to really assess. So eventually we do end up catering to all levels of society.
I have another question regarding first responders. Have you done any work with first responders, whether Red Cross or let's say قوى الأمن درك? Have you done work with them? Have you taught them how to deal with mental health patients? And
so the Red Cross and the ISF are huge institutions, right? But we have done trainings for these first responders. So we've trained people in the Red Cross on how to deal with calls to the Red Cross that are about imminent threat or just a suicide threat. And we make this distinction إنه إذا حدا هلا عم بيأذي حاله بطريقة أو حدا عم بيفكر يأذي حاله أو third party بتلفين إنه ليه أنا عطلان هم ابني. So we've taught them how to deal with that. And we've also done workshops with first responders in the internal security forces. كمان in terms of how to deal with that. لأنه قبل البوليس لما يجي يشوف حدا how they talk with them is not from a perspective of trying to understand them and bring them to their side. So training them on how to deal with that has really helped. وعن جد يعني اللي كنا نشوفه قبل ونسمعه إنه شو صار لما إجا الصليب الأحمر أو شو صار لما إجا الدرك كان شيء بزرزع البدن يعني. With time, we have been hearing and knowing about more success stories, more empathic and more active listening skills that are being used in these situations. So we have seen the impact of that, really.
That's perfect.
More needs to be done, though. That's why I started. They are huge institutions. Obviously, we cannot train everyone yet. Much more needs to be done, but we have started.
I think what you are doing should be implemented at the national level by the government itself also. So this is something very important. So if there's any other questions to Dr. Zeinoun? No? Okay then. So if there's no other question, I'd like to thank you again, Dr. Zeinoun. We have one more from Ms. Karake. Did you observe an increase in suicidal attempt during the COVID lockdown?
Attempt, I am not sure. I don't have that data on top of my head, but an increased calls, yes. So we did get an increase in calls. ما بعرف إذا بتتذكروا بالسلايد, but we cannot attribute causality to this. So it's very difficult to say it is the lockdown that caused the increased calls because there might be many other reasons. يمكن كان في awareness أكتر. يمكن كان في some shifting demographics at some point. So yes, we did see an increase. Was it because of lockdown? We do not know.
We have also another question. Is there any chance for people who are interested in mental health but not majoring in psychology to join Embrace community?
أكيد. Absolutely. I'll make a point here to say, and our volunteers, the operators, are not psychology majors. A lot of them are, it happens they are because they're interested in this, but a lot of them are not. They come from all walks of life, all ages. You get trained, and actually studies show, and as if you are a non-psychology major, you'll do better as an operator than if you're a psychology major. And in addition to that, there are many other things that Embrace people can do. So there is research, there is admin, there is communications department. So there's a lot of other things that people can be involved in. Some of these things are volunteer basis. Some of these things can be job opportunities. We regularly post, for example, on Dalil Madane about various jobs, and some are internships. So there's definitely many ways and for many majors and backgrounds.
Perfect. Okay, so let's conclude this session by thanking you, Dr. Zeinoun, for this great talk. Very informative and interesting talk. We are much grateful for the great work that you are doing at Embrace, and I wish you good luck with the future also in Lebanon and everything you do.
Thank you so much. Thank you for having me. Thank you for listening and being supporters. Thank you.
Great. So that concludes our session for the day, and we will see you on our next webinar. Bye-bye.
Bye, everybody.